Good afternoon. Thank you for joining us today. We're going to walk through our updated numbers in a minute, and there is reason to be cautiously optimistic. We've certainly seen a momentary decline in the number of cases. We obviously want to see a longer trend over a longer period of time, and then we remain somewhat concerned with the prevalence of the new strains that we believe are more contagious. But it certainly appears that things are headed in a better direction than where we've been in terms of case count. Of course, any significant impact on hospitalizations, if we do in fact see a sustained decline in cases, there will be a lag or delay of 21 to 24 days before we're likely to see a corresponding decline in hospitalizations. And we continue to really implore the public to please follow the public health orders. We know that they will work in slowing the transmission of COVID-19. And if you look at where we were with case counts in the hundreds, we still have quite a ways to go, but we do appreciate the actions of San Diegans to take action to help us try and get through this as it relates to cases. We also know that there's considerable interest in many regards, very good news surrounding vaccine distribution. Our healthcare systems are administering vaccines. Our county sites, which we are adding to on a regular basis, are seeing considerable demand for vaccines as well. I'll share with you an update of all of the locations that we have, but today Supervisor Vargas, Mayor Salas, Sharp Healthcare, and the county opened our second Superstation event in Chula Vista, at the Sears building in Chula Vista. This adds to the site that has been underway at Petco for a little bit, and so those are two Superstations that are now open. We also have plans by February 1st to open a Superstation in East County and North County. We also presently have 8 smaller pods, points of distribution, that are administering vaccines daily, and we have plans again to double this number again by February 1st to ensure the maximum convenience and locations for people to be able to receive vaccines. And as we add these, the appointments will be available via our website, where people can go on and click and see what's available. We know that there's tremendous demand for appointments, and often as soon as they're made available, they are quickly gone. And in some regard, that is encouraging because there is such significant demand to get vaccines. But we have to continue to work through the process of receiving vaccines and then simultaneously standing up the infrastructure to be able to administer them. And again, what the county is doing is just additive or on top of what our healthcare partners are doing daily, what the VA is doing, what DOD is doing, what the pharmacies are doing. So it is a multi-pronged and multifaceted approach to doing that. We have, in the last 48 hours, been shipped 173,000 vaccines. Again, a small portion of those are for the county government to use at our pods and Superstations, and the rest are distributed throughout the system for individuals doing it. And so that is encouraging. That is a significant shipment that is just arriving now as we speak, and we are building out the infrastructure to be able to do it. And then there's considerable uncertainty about how many you will get or when you will get them. And so we continue to try and build out the infrastructure to accommodate for that uncertainty, and we will continue to work through that. And we appreciate the community's patience as we build this up. We know in some cases there are instances of traffic and backups and people having difficulty getting appointments because they aren't available. But again, this in large part is a testament to the demand for the vaccine, and we will continue to work every day to make the system more seamless and easier to move. We also appreciate the federal government increased focus and effort around vaccine distribution and rollout and COVID response in general, and we think that this will help us as we move forward. We know and recognize that vaccines represent our way out of this. Vaccines alone will not get us there. We have to continue to follow the public health orders to slow the spread, but we are working aggressively in our county to make as many locations available as possible, to build out the infrastructure to make it easy to get into that system, and to continue to do everything we possibly can to get the maximum number of San Diegos vaccinated as quickly as possible. And as it stands right now, healthcare systems or individuals who have vaccines concurrent with state guidance are able to vaccinate healthcare workers, and healthcare systems or others who have vaccines are eligible to vaccinate those 65 and older if they have the available supply. Our county system of pods and superstations will continue to focus on vaccinating healthcare workers, and we have opened up those appointments to those 75 and older. When we get through those and we start to see some slack in appointments, as Dr. Wooten has stated, when we get to that point, then we can expand that to 65 and older, but we're not there yet. And so right now, the appointment-based system is available for healthcare workers and those 75 years and older. We do ask San Diegans to not go to a vaccine distribution site if you do not have an appointment. It is not a walk-up or show-up absent an appointment. And so part of the traffic concern and that we're facing is individuals who are showing up just hoping to get a vaccine. We need to hold true to the appointment system. It helps us ensure efficiency and helps us move people through. We also ask individuals do not make an appointment if you are not a healthcare worker or 75 years or older, because by the time you get to registration and you don't meet those criteria, you will be turned away, because we want to follow the tiered system as we work through each and every one of these steps. And again, we ask for the public's continued patience and help as we work through this. One thing that we will be adding tomorrow for seniors 75 and older only who do not have computer access to make an appointment via the website is starting tomorrow. They will be able to call 211. Again, this is only for seniors 75 and older who do not have access to a computer or someone to help them navigate through the online system. Someone will be there to help connect them to their health system partner. We continue to ask all San Diegans, see if your healthcare provider has them first. If they do not, then utilize the appointment systems of the county. But starting tomorrow, seniors will be able to call 211. And again, please be patient, because we expect there will be significant demand on this phone line, and there are a limited number of appointments. And so we ask for everyone's patience. 211 has been a wonderful partner, and they are working to ramp up their ability to access calls. And so again, we ask for everyone's patience, and please do not call 211 about vaccines unless you are 75 years or older and you do not have access to a computer system. Last week, we shared with you our overall approach and where we wanted to get to as a region. Our approach remains true. We want to have 4 superstations along with approximately 16 pods. We want to have them set up by February 1st. And our goal is to have the capacity as a county entity at county-sponsored pods in partnership with others to be able to do 25,000 vaccines per day every single day. And we continue to build towards that very ambitious goal, and we will share with you progress as we go. The other thing that I will share with you in a minute is our dashboard, which we share the top line numbers, but our dashboard is now on the website and is accessible. It will show you the total dosages shipped, how many have been administered. We also have a breakdown of those who have received vaccines by gender, by race and ethnicity, along with geography. 2 important, very, very, very important caveats is dosages shipped just means that's what has been sent within our region. So we just, as I mentioned, received 173,000 vaccines shipped within the last 48 hours. That will show on there. And on the administered dosages, those are just has been recorded in San Diego Immunization Registry. There is a considerable lag between people putting a shot in an arm and catching up the paperwork. And we certainly don't want paperwork to slow down the administration of vaccines. But Dr. Wooten is working with our providers that are lagging a little bit on getting that data updated. And so we know the number of doses administered is considerably higher than what's showing on the dashboard. But again, we will work to continue to do that. But our focus and our priority remains on as quickly as we possibly can getting vaccines in the arms of the appropriate populations at the appropriate time. And that portal is updated and again, will be shared in real time and be updated in real time throughout the duration of what we face. So again, considerable energy and focus, tremendous public demand. County continues to stand up more sites, work on streamlining registration sites and process of getting in, and we continue to do all this under great uncertainty about how many vaccines we will get or when we will get them. But we are trying to put in place the foundational parts we need to get our region through this and administer as many vaccines as we can as quickly as possible. With that, let's jump into our charts. What you'll see here is first on vaccination locations. These are the current interface system. We're one of the pilot counties along with LA County that we hope to launch that very, very soon to have a more seamless and more integrated approach towards making these reservations. On the next slide here, what you'll see is a map. Partners are doing, VA, DOD, and pharmacies are all doing as well. Next chart, you will see the dashboard, which is available. Again, there is a lag on this. We know that the actual number of administered dosages is much higher. People have to catch up the paperwork and get those all administered in, and we're working with entities to try and help speed up that process so that we have more real-time updates. And then below that, you see the number. Their first shot, fully vaccinated there at 29,158, represents those individuals who received a second shot, and we have 1% of our population 16 and older who are now fully vaccinated, and again, we will continue to update this. You also see the breakdown on here by gender. Obviously, the bulk of these vaccines that have been administered are to healthcare workers, and so your breakdown, both race and ethnicity, gender and geography, will in large part track the healthcare workforce of San Diego County, which is the overwhelming majority of these. And so we will continue to drive with an equity focus to make sure the communities impacted receive it most, but we have to do that consistent with the tiering system that is laid out. And again, this dashboard is on our website and will be updated in real time, not weekly. We will update it daily as we get new information and new data, and folks can access it as we move forward. Let's get quickly into our cases. What you will see today, we're reporting 1,176. Again, and Drs. Wooten and McDonald can speak to this in greater detail. There is reason to be somewhat optimistic, but again, we want to see continued trends over time, before we really are confident we're going in the right direction. And we don't in any way want any even modest decline in cases to have us lose our focus or adherence to the public health orders, because as quickly as numbers could trend one direction, they can rapidly turn around and trend another direction, particularly with the more contagious strain of COVID-19 now present in San Diego County. Hospitalizations, again, you see a slight uptick there in COVID-related ICUs, a slight downtick in total COVID-related hospitalizations. And even if we do see a decline in cases, again, because of the lag in hospitalizations, it could be a little bit before we see any significant relief on our hospital system. Next one, you will see the COVID ICU and non-COVID ICU system capacity. Again, the COVID-related ICU census popping up to 438. This is a high out of what we're seeing. Non-COVID ICU holding steady right there at 241, and then 46 being the number of staffed and immediately available ICU beds, including pediatric beds. The last chart I have is our COVID-related deaths. 48 new deaths today. Loss of life 65 yesterday. That was an all-time high. And again, the loss of life will often lag an increase in hospitalization, which will lag the number of cases. And so we continue to work very hard to both simultaneously respond to the COVID-19 pandemic and spread and build out the infrastructure needed to administer vaccines. And we certainly hope that a steady supply of vaccines will be coming and hopefully coming on a regular basis so we can better meet the need and the demands of San Diegans. We'll hear briefly from Supervisor Nora Vargas, and then we will take your questions. Drs. McDonald and Wooten are here and available for questions from all of you. With that, I'll turn it over to Supervisor Vargas.
Thank you, Chair Fletcher. As many of you know, we are still receiving a high volume of questions and feedback from the public as we are working to ensure we have the correct information not only on our website, but information for our communities as well. As we're making decisions to allocate county resources, we're really being guided by through what they call an equity lens, which is a motion that we just passed this last time around. We chose today, I was very excited to, as Chair Fletcher highlighted, to join the members of the Council of the City of Chula Vista, as well as our partners at Sharp Healthcare, to be able to open up the first superstation in the South Bay. This is a very important superstation, number one, because people in our communities have had the opportunity to actually go to the center to get their COVID test in the past, and it has worked. Number two, aside from it being a familiar location for our communities, it is also a testing location now that people can walk to for the vaccines, which is really critical, particularly in the South Bay when many of our community members are using public transportation and don't have access to cars. And so, again, it's really important to reiterate that if you are in phase one and or 75 or older, it's really important to make an appointment. Today, there were about 1,800 appointments made. The vaccine center will be open from Monday through Sunday from 10 a.m. to 7 p.m. It's really important that you make an appointment before you go there so that you can make sure that you have what you need. This weekend, we're very excited also to be creating a partnership with the City of National City, and we'll be opening up our next pod. Also, the fire department will be part of this work. More information will be forthcoming on this. Phase one is still part of the community that we're gonna be working with. Es muy importante para todos nosotros comentarles, y como decía Chair Fletcher, que aunque las cosas han cambiado, aunque las cosas han cambiado en cuanto la administración a nivel nacional, seguimos teniendo un impacto en cuanto al número de vacunas que se están dando a las comunidades, ¿verdad? Aunque no han llegado más vacunas, de todos modos, estamos ahorita lo que estamos haciendo es creando una infraestructura para poder distribuir el número de vacunas que se necesitan en las comunidades. Es un momento muy importante para todas nuestras comunidades, ya que la vacuna va a poder ayudarnos a poder volver a nuestras vidas cotidianas. También quiero hacer mención que esta mañana tuve el orgullo de estar en la ciudad de Chula Vista con la alcaldesa y otros miembros del concilio para abrir la superestación de vacunas en el sur del condado de San Diego. Con esta superestación ya son 2 superestaciones en el condado de San Diego, la otra es el Parque Petco, y tenemos programado que para principios de febrero se van a abrir una más en el este del condado y otra en el norte del condado. Quiero enfatizar que al elegir estos sitios de superestaciones, lo estamos haciendo definitivamente en donde que sea familiar el lugar para las comunidades. Además, es importante para nosotros que haya transporte, acceso al transporte. Por eso esta superestación en Chula Vista es una cosa muy diferente de las que hemos hecho, ya que la gente va a poder participar de pie, ¿verdad? Entonces, lo que sí queremos enfatizar es que es muy importante que las personas, antes de que vayan a la ciudad de Chula Vista o cualquiera de estas superestaciones, que hagan su cita por medio de la página web, porque no va a haber, no puedes llegar nomás y que te den la vacuna, tienes que poder hacer una cita. Entonces quiero aprovechar también que este fin de semana con la ciudad de National City vamos a tener la oportunidad de tener un nuevo sitio de vacunación en otro sitio en el sur del condado, y esta colaboración son con los bomberos también de National City. Por último, quiero mencionar que es importante que las personas entiendan que la vacuna es una de las maneras en las cuales vamos a poder combatir la pandemia global de COVID, que ahora más que nunca, para tener una buena recuperación económica y para la que exista una reapertura en nuestras comunidades, tenemos que tener la vacuna, pero es importantísimo que de todos modos usen su cubreboca, estén a 6 pies de distancia y lo más importante, no convivir con personas que no son de sus familias inmediatas. Así que muchísimas gracias. Tenemos más información y ahorita cualquier pregunta la respondo.
Thank you, Supervisor Vargas. I was told we had an audio glitch when we did a few of our slides. If there's any questions surrounding those, we can bring those slides back up and reiterate those main points if you have any. With that, let's go to our call-in questions.
John Carroll, KPBS.
Taking my questions. First off, just wondering about the online process of booking appointments. We've gotten a lot of emails and calls from our viewers and listeners, seniors 75 and up, and family members that are trying to help them, that it's very difficult, it's not intuitive. Once you fill out all the information with what you're allergic to and stuff like that, you get to the appointment part at the end, and then if there's no appointments, you have to go back and fill all that out again. So my first question to you is there any effort to improve that experience for people? And then I do have a follow-up.
Yeah, we definitely have plans to improve it. John, we're working with the state of California is launching an integrated kind of portal where people could more easily sign up and access available appointments. And we hope for that to come out in the coming days. We do know it is a little tedious and a little clunky at times, and we're working every day to streamline what we're doing. So we certainly don't want to inconvenience anyone in the process of getting a vaccine. We are seeing pretty much every single appointment filled, and so we know people are able to work through there. So it hasn't been a hurdle that has impeded our ability to administer vaccines, but we want to make it as user-friendly as possible, and so we're definitely working daily to make it easier.
Thank you. And then also the notification system that the county has talked about standing up. What's taking so long for that to happen? When can we expect to see that?
So we're planning our own kind of internal county portal and system, and then the state of California announced us that they were doing an integrated one, and we thought that it would be out by now, and so we opted to go with them. We were included with LA County in the pilot counties that will be doing it first, and we hope that system is we're able to roll that out in the coming days, and so that'll be a truly integrated system where people can sign up for notifications and alerts. But we thought it better, instead of launching a county system and then having to replace that system with the new system, it was better to wait a few days. And again, we lobbied the state to be in one of the first counties to be able to use it. Our data folks have been working around the clock with the state to refine that system, make it as easy to use as possible, and we hope that will be launched in the coming days.
Thank you, Supervisor.
Thank you, John. Next question.
Ashley Jacobs with Fox 5.
Hi, thank you for taking my question. It is actually related to one of the slides. So I understand that the numbers are actually greater than being reported, and there is that paperwork lag. But could you clarify or confirm, I just want to make sure I understand it correctly, 1% of the population is currently fully vaccinated, having received 2 shots. Could you speak to that a little bit?
Yeah, that's correct, Ashley. So it's 1% have received both their first and second shot. Now, it's important to note that is 1% of the San Diego County population that is 16 years or older, because that is the only population we are presently vaccinating. And again, as our numbers increase, and they are increasing daily. Today we brought on a second superstation. We're planning to bring a third and a fourth, along with more pods, along with our health system partners. And we're hoping that increases in vaccines continue. So if the increased shipments continue, then obviously the numbers we can administer will be greater. And we will continue working through this as fast as we get vaccines and can get them out.
Okay, and a quick follow-up for you. Since you do want to ramp up the number of vaccines, and I know that Biden signed several orders today, and that's his goal as well. Do you think with the new administration in place with President Biden that is going to have any direct impact on San Diego County? Anything specific that he has planned?
Well, we hope it does. I mean, a number of the things that they're proposing are things, requirement to wear face coverings or things that we've done. Transparency and data and dashboards and all of that, again, are things that we've been doing for a considerable time. But we do hope in particular that the speed and frequency at which we get vaccines will be increased, and there is some hope that there will just be some certainty. If we had some reasonable schedule, if we think you'll get this many on this many dates into the future, then it's much easier to plan accordingly. We tend to live in a boom-bust cycle where we're concerned we might have to shut down pods or superstations because we're going to run out, and then we kind of get a large shipment. Now, we're not complaining about large shipments. We'd rather have large numbers of vaccines arrive very quickly than not, and so we're not in any way complaining about that, but certainly hoping to see an increase in the steady delivery of vaccines so we can get them out quickly. And, it's going to take a little bit of time. Things go from the federal level to the state level, and then they end up making their way down to us. But we're certainly optimistic that the situation will improve.
Okay, thank you so much.
Thank you.
Our next caller is Artie Ojeda with NBC7.
Good afternoon, everybody. Supervisor Fletcher, I think you pretty much addressed it, but let me just give her some numbers here. And I know you all are working fast and furious on this, but last week you said the goal is to vaccinate 250,000 people by the end of the month. If I read that chart right, so far 29,000 people, 1% of the population, as you said. You're only as good as the number of doses that you have, but it sounds like you have the doses shipped to meet that goal. So do you still think you can meet that 250,000 goal by the end of the month?
Yeah, Artie, I believe the goal was to administer 250,000 dosages in the month of January, and that would be that top number, the 181,000. I believe that we will not only meet but surpass that goal of dosages administered, and so we're going to continue to work ahead. And again, the shipment that we just are in the process of receiving now is obviously a not insignificant amount, and we, again, are working to have the outlets to be able to administer those. So I think we will hit the goal of 250,000 dosages administered. And then the other goal, Artie, that we're working towards is by February 1st, provided we as a county entity have the vaccines, to be doing approximately 25,000 a day every single day through our pods and our superstations. And again, that is additive to all of the great work our healthcare partners are doing and that other entities that also get vaccines are doing. So we have our internal goal of what we want to do with our county-sponsored sites and then our regional goals of what we want to do. And I think that we will hit our January number, if not surpass it, but we'll have to see how it goes over the next 10 days.
And a quick follow-up to that, Supervisor. You talked about looking for volunteers. Any update on recruitment of more vaccinators to actually work the pods and super centers?
Yeah, we've had a great response from the medical community that are willing to show up. We think that there's more than 600 volunteers that we expect to have cleared to work by the end of the weekend. The lack of those has not impeded our ability to run the sites we have open now, but as we seek to expand considerably, we will need those individuals, we'll need the partnerships we have with paramedics and EMTs, along with the incredible partnership of our healthcare system partners that are making vaccinators available. And we continue to build out the other folks that are needed to administer at a vaccine site, everyone from registration to check-in, traffic control, all of the other components that we're doing. And so we'll continue to look for more and continue to work for more creative ways, and we'll assess as we move on in real time. But the response to the volunteer network has been very helpful.
Our next caller is Matt Hoffman with KPBS.
Hello. I know Supervisor Fletcher keeps saying that you hope to get more vaccines, on a regular basis to keep this momentum going. But have you guys gotten any assurances from the state or federal government about what's coming, or are you guys literally flying blind, so to speak, day to day, week to week? And with that in mind, for you all at the county, is it a real possibility that you could be soon having? I know we talk about opening up a lot of sites, but scaling back, dropping capacity, stopping some vaccinations.
Yeah, I mean, like so much in COVID, going back to the beginning, there's things we know and there's things we don't know. And we don't know what tomorrow or next week or the week after will bring. We certainly are very aggressive in requesting vaccines. We're very aggressive in conveying. We are building out tremendous infrastructure to be able to get these, and we're fighting for every single vaccine that we can possibly get, and we'll keep doing that. But we don't have a schedule. We often don't know until we're told, hey, this was just shipped, what it will be or what happened. Now, again, you know, I don't want to give the sense that we're complaining. We will take whatever gets thrown at us. We will figure out a way to navigate through it. But there is a concern that we could build out all of this infrastructure and then not actually have the vaccines to administer, and that would be a bad situation. What would be worse would be to have significant increases in the shipment of vaccines and not have the infrastructure built out to be able to administer those. And so much of COVID, you're choosing between bad and worse. And so we think it is wise to be aggressive, to make the investment, to build out the infrastructure, to streamline the portal and registration and sign-up system with the belief that vaccines will continue to come. And I think the public understands we can only administer vaccines we have, and we have very little control over that process. So we'll focus on what's in our control and continue to advocate and fight to get as many as we can in San Diego.
And then I know it's been a year to day since the first case in the U.S. was reported in Washington State. And maybe a question for Dr. Wooten. If you guys look back just in the last year in San Diego, is there anything you reflect on? You say, you know, I would have done this differently, or I would have done this, or, you know, kind of comment where we are now, 1 year since the first case was reported in the U.S.
Yeah, I think you'll have Dr. Wooten respond to that.
Good afternoon, and thank you for that question. I feel very confident and very proud of the response that we've provided in responding to COVID-19. Our staff have been working diligently, long hours. We've, at the onset, followed CDC guidance, the guidance from the White House in terms of specific metrics to follow, and then adhered or adopted the metrics from the state. The most significant thing that I wish would have happened that didn't happen is that if people, a majority of people, and then has or did follow the health officer's orders. That is what I wish would have happened. We saw how it happened in July when the restrictions were placed, and we know that those practices make a difference. And as was stated earlier by Supervisor Fletcher, we only have 2 days of the lowest numbers, but we need a longer trend. So we will cautiously watch those numbers and continue to vaccinate. Vaccinate, vaccinate, vaccinate. Thank you.
Thank you. And then just one other quick follow-up. Did you say the 438 in the ICU yesterday countywide, is that a high since the pandemic started?
We believe it is, but let us we believe it is, but let us confirm that for sure and get back to you. I also didn't realize this is 1 year since the first case, and I want to thank you know, look, COVID's been difficult on folks, on small businesses, on parents, on teachers, on healthcare workers. You know, a lot of folks are working hard, but I want to thank Dr. Wooten and her team, Dr. McDonald, along with the hundreds of folks that you never see or hear from. That literally work around the clock. It's ever changing, it's dynamic, guidance changes, rules changes, and you know, we're left trying to implement those. And we'll continue until we get all the way out of this, doing it every day. But there's a lot of folks that have been working around the clock for a year straight, and we're grateful and appreciative to all of them. Next question.
Jonathan Wilson with the San Diego Union Tribune.
Yeah, thank you for taking my questions. A couple quick vaccine-related questions. Supervisor Fletcher, you mentioned that San Diego 75 and up who don't have a computer will be able to call 211 to get more information about appointments. I just wanted to make sure I understood. Does that mean they can make appointments to get vaccinated at a county-run site, or they'll be connected with their healthcare provider? Can you just clarify that?
Yeah.
If it is for a county-run site, are they going to get some kind of document they can bring with them when they go to get vaccinated at one of the super sites or other points of distribution? So that's kind of the first question.
Got it.
And the second question is just, are we still on track to begin vaccinating people 65 and up at county sites the week of January 25th? I think Dr. Wooten has mentioned that in the past, so just wanting to know where we're at on that.
Yeah, thank you, John. Before I address your question, just on the previous one, I did just confirm the 438 in ICUs is a new high for COVID-related ICUs. So that, just confirming that fact for you. The 211 site, John, to your specific question, what individuals, when they connect with someone on the phone, will be to try and connect them to their healthcare provider and help them get an appointment. But again, healthcare providers have tremendous challenges in the availability of appointments. So that, again, we encourage all San Diegans, if you can get it from your healthcare provider, please do. But we don't want to overburden them with a series of calls. And so they'll try and facilitate that. If they can't facilitate that, then they will have the ability to schedule that senior 75 and older if there is an available appointment at a county site for one of those appointments, along with giving them information about where they go, what time they should get there, and what they should bring. In terms of a document, if they're calling into the line, they probably don't have good computer access, so it'd be hard to send them a document that they could print out, but they will be given the information they need to ensure they can arrive at that vaccination site and get vaccinated. So the aim of this, again, is again, we want to be so clear, this is just 75 and older who don't have access to a computer to call. And again, recognizing the number of available appointments and vaccines is far less than the number of people in the present tiers who want to get in. So we ask for everyone's patience, but they will help facilitate the making of that appointment. Did I answer both your questions?
The second one was just simply, are we?
Oh, next week. We hope, but again, we have to really look at the appointment-based system. And I think when we start to have some slack in the appointment system, where they're not immediately filled by healthcare workers and 75 and older, then I think we could move to that next age tier. It wouldn't make sense to do it now because there aren't enough appointments for people who want them, who are in the current tiers. And so we'll continue to monitor that in real time. And once we see some slack in that system, then under Dr. Wooten's guidance, the tiers will be adjusted to 65 and older, but we don't know when that will be.
Okay, got it. Thank you very much.
Thank you.
Our final call-in question is from Brandon Lewis with CBS 8.
Thank you. Supervisor Fletcher, just to clarify what you said before, how much notice do you get when the shipment of vaccines is sent to when it will arrive? Are we talking about a day, 2 days? Can you quantify that for us, please?
It's about a day.
Okay.
If that, yeah.
Okay, and the next question I have is, I know you acknowledge that the race and regional data is tracking along what is the healthcare workforce right now.
Right.
But now that seniors are starting to get vaccinated, when do you think the data will be more reflective of the county at large? Because it looks like there's a lot of people from the north and central communities and white residents that are disproportionately getting the vaccine versus when the virus has been pretty prevalent in the South Bay and Latino communities.
Yeah, and we think about that a lot, Brandon, in terms of responding based on health equity. I mean, that is a adopted policy of the County of San Diego to respond consistent with health equity. Of course, we are constrained by the tiers that we are in. And so the current numbers, the vast majority of those represent healthcare workers. And so the breakdown you see here is generally consistent with healthcare workers. Again, now as we're interspersing seniors into this, I think that will start to adjust. And I think, Brandon, if you look at the map of the placement of the tiers, and you look at that, and if we pull up the COVID location map, I think this will give a good indication. So what you see on this chart is you see the case rate per 100,000 by zip code. Obviously, the dark colors there representing the communities that are highest impacted. The light colors there representing the communities that are less impacted. And so you can see the general disbursement. And what you see is where we are placing our county pods are in those communities that have been most impacted. Now, they're not limited to only people from those areas to go to them. But again, we are doing everything we can with great intentionality to put the location of pods and of superstations in those communities that are most impacted and make those available to those residents. And so we're going to serve the whole county, and we're going to build out more pods. And a lot of people who are in maybe lower impacted communities are also in communities that have higher access to the vaccine through their healthcare provider. And so again, this is just what the county is doing. And so our efforts will continue to be driven via a lens of helping those communities disproportionately impacted. But the total numbers that come into the system are not the totals of vaccines administered at county-sponsored locations. They're the totals for everyone in the county who's administering vaccines. And so I think that's some important context. But again, as you see right there with the placement of the locations, we are trying to place them in communities that have been most impacted, and we'll continue to try and do that.
Thank you, Supervisor.
Thank you. Go to our text questions.
First text question is from Marilyn Hyder with Kogo News. She wants to know how Alpine teachers were able to be vaccinated this week.
Yeah, we saw the story that came out surrounding that. Right now in the state of California, Tier 1A healthcare workers are eligible to get vaccinated, and those 65 and older. If entities have vaccines, they can do that. Obviously, at the county, we're doing healthcare workers and 75 and older. We have not yet moved into the tier of essential workers, regardless of age. And so in this instance, a federally designated entity received vaccines directly from the federal government. They made the decision to give them to those teachers in that area. For the county, in terms of what we're doing, we're going to continue to follow the tiers. We want to vaccinate everyone. We want to vaccinate teachers and firefighters and essential workers and service workers and restaurant workers and all of that. But our efforts have to continue to adhere to the tiers. But that was a decision that was made outside of the county system. Vaccines received directly from the federal government to an entity, and they went forward with administering them in Alpine. Next question.
Next question is from Jennifer De La Cruz with ABC 10 News. We're hearing reports of some vaccines being thrown away so they don't go bad instead of being given to people who aren't in phase 1A. What is the guidance on doses that would otherwise expire?
Yeah, there's been a number of very concerning stories nationally about that happening. In San Diego, we put in place procedures so that vaccine locations should have individuals in the appropriate tiers on standby in the event at the end of the day they have any vaccines left over. And we will continue to push those procedures here locally.
Next question is from Kimberly Hunt with ABC 10 News. She's asking, for those getting their first Moderna shot at county sites such as Petco, what is the range of time for which it is safe to get their second shots when there is no appointment available past before the 28-day mark that is required?
When individuals get a shot at a county-sponsored site, they are scheduled for their second dosage while they are there receiving their first dosage. So they should not have to log back into the system to create a second appointment. When they get their first dosage, they're scheduled for their second dosage, and ideally at the same location.
Okay, so next question is from Richard Allen with CBS News 8. How effective do the COVID vaccines being rolled out right now appear to be against the new, more contagious strains of the coronavirus? Are there any concerns about the current vaccine not being effective enough in guarding against these new strains?
I'll have Dr. McDonald address that issue.
Thank you for that question. The answer from the virologists who are experts in this area is that it appears that the vaccine should be able to cover these emerging variants very well. We won't really know that, though, until the variants have been around long enough and the vaccine has been given to enough people, because these variants didn't exist when the trials were conducted to demonstrate that the vaccine was effective. So there's every good reason to believe that it will on the biological basis of the vaccine, but we won't really know the answer until some time goes by. And that also gives me a chance to update that the number of B117 so-called UK variant cases that we've had so far in the county of San Diego is increased since the last time we had a briefing. We've had 69 confirmed variant cases in San Diego and 28 probable cases for a total of 97 total cases. This is actually the number we expected to see at this time, and we continue to detect those and follow those very closely.
Thank you, Dr. McDonald. Our next text question.
Next question is from Jack Mulmood with News 8. We've seen long lines outside Petco Park and people are having difficulties in scheduling appointments. Can you please explain what's making things so difficult to get vaccines to people?
Yeah, there's just a tremendous demand, which is a good thing. In many ways, the number of people who want to get the vaccine and are very eager to get it, which we certainly understand, is just greater than the capacity of what we have now. And so some of the appointments being immediately taken or just a supply and demand type issue that we hope alleviates itself as we get a greater supply of vaccines and as we build out more infrastructure to get them. As it relates to the traffic, some of it is anytime thousands of people are all going to one location, you're going to experience some traffic. If you go to a Padres game and park in Tailgate Park, you're going to have some traffic. You go to a concert. Some of it is compounded by individuals showing up without an appointment. And again, we continue to stress to the public, if you don't have an appointment, please don't go to one of these locations. You will not be getting the vaccine. And then every day we work to figure out are there ways we can streamline and better manage the traffic flow in and out. And so we know residents don't want to be impacted in their neighborhood by traffic. We know individuals that are going to get a vaccine would prefer not to wait in traffic to get to their appointment. But we also know that people want us to get as many vaccines as quickly as possible. So every day we work on making the traffic situation better, the sign-up situation better, more opportunities and more venues. But our bias now is towards setting up the infrastructure so we can get as many vaccines in people's arms and then making it better as we go along. And every day we'll try to make it a better experience in terms of the ease at which people get the vaccine.
The next questions are from Gary Worth with the San Diego Union Tribune, and they're related to President Biden's COVID response plan released. Actually, he wants to know, have you read President Biden's plan, and do you see anything in that plan that could specifically help San Diego?
Yeah, I've looked through it, and I think it's encouraging. I think a consistent, steady response from the federal government will be very helpful. I think the way that San Diego will benefit most will be in two particular ways. One is increased efforts to aid and assist those individuals and businesses that have been impacted due to COVID. I think that the more resources there are available to individuals, the easier it is to comply with the public health orders. And then the second area, I think, would just be the availability of vaccines. If we can really open up the pipeline and have some certainty about what's coming and on what schedule, it will make it much easier to be able to tell the public, hey, we think by this date we'll get to this group, and easier to plan and execute. And so we recognize it'll take them a little bit of time to get those changes into effect, and it'll be even a little bit longer until it makes its way down to us here at the county. But we are encouraged and we're very hopeful that we will see that. And in the meantime, we will keep doing everything we possibly can as a county. We hope that there's more resources to pay for all the costs we're incurring surrounding vaccines to help with that. But we're not going to let any of that hold us back now. We will continue to move as swiftly as we can, be as transparent as possible with you all on both the challenges and the successes and the opportunity. But we do think that this is a welcome change and will certainly be one that will be helpful to not only San Diego, but the whole country.
The second question Gary had was in regards to the plan calling for creating 100 vaccination centers for underserved communities and populations hit hardest by the disease. Have you heard if San Diego might get one of those centers?
Well, I don't know if we'll get one from the federal government, but San Diego's already got 8 of them, 10 of them, courtesy of the County of San Diego and our partners. So in this instance, we're not waiting for the federal government to stand up vaccine centers in disproportionately hit hard communities. We're doing it. And we will continue to do it, and any help and assistance we get from the federal government will be wonderfully appreciated, and we will certainly take. But we're not going to wait for that to trickle down to us. We've already started doing that, and we'll continue expanding that.
Next question is from Lisa Halverstedt with Voice of San Diego. She wants to know if San Diego San Diego Superior Court earlier this week began allowing defendants and their attorneys to appear in person for traffic and other infraction cases if they choose to do so after a month of only allowing virtual appearances. Was the county aware of this policy change? And can you say if the county has weighed in on this change? What guidance have we given?
We were not aware of the change, and because we were not aware, we did not weigh in on it. Next question.
Next question is from Mike McKinnon with KUSI. He's asking, the MLB is letting local governments and health officials decide if they open their stadiums. Is anyone from the county working with the state to safely get fans in the stands for Padres games?
At the county, we're working daily to lower the case count, get people vaccinated, which will give us the ability to get kids in school, businesses open, and fans back in ballparks. And so we think that the efforts we're taking, again, to slow the spread, alleviate the pressure on the hospitals, get people vaccinated, are all designed to achieve that aim. And we will continue to work with the state of California on any guidance surrounding any aspect of the COVID response.
And Chair Fletcher, the next two questions are for a Spanish response, so I'll have. The first one is from Claudia Bujio with Univision San Diego. Many seniors are struggling to set their appointments for COVID vaccines due to technological issues. What is the county doing to make it easier for seniors to sign up?
La pregunta es sobre qué estamos haciendo en el condado de San Diego para ayudarle a las personas de tercera edad que de alguna manera están teniendo complicaciones cuando van a la página web para poder hacer sus citas para la vacuna. Estamos comprometidos a ver de qué otra manera podemos ayudarles por el momento. Los estamos invitando a que marquen al 211 para poder hacer una cita para que puedan vacunarse. Sabemos que ha habido problemas con el tiempo, ¿verdad?, que está durando para encontrar una cita. Hemos estado trabajando también junto con las organizaciones y las clínicas de la comunidad, específicamente en las comunidades de habla hispana. Estamos viendo otras maneras de ayudarles, pero por el momento le pedimos a las comunidades que hablen al 211 para que puedan hacer su cita y de esa manera se puedan tener su acceso a su vacuna. Pero sí es algo que sabemos que tenemos que mejorar y es prioridad para nosotros en el condado.
And this last text question is from Saddam with Univision. Can you please provide details about the information being shared with local police agencies, specifically the address of COVID patients? How can the public be assured their information would remain private?
Ajá. La pregunta específicamente es si es confidencial la información que se le da de que cuando la gente hace las citas para las vacunas. Como cualquier otra persona que usa servicios del condado de San Diego, yo les quiero asegurar que esa información no se está prohibiendo a nadie más. Es sumamente para nosotros importante que las personas de esta comunidad sepan que es confidencial su información. Cuando haces su vacuna, estamos trabajando porque sé que ha habido varias preguntas sobre los seguros sociales. Todo eso lo estamos viendo, pero quiero que la gente sepa, por favor, que la vacuna primeramente es segura, que su información es confidencial y que no se la vamos a dar a cualquier otra persona. Gracias.
And just to follow up on that question in English, at the outset of the pandemic, there were limitations on public safety and first responders' access to PPE, and so the address was shared in general so that if a 911 call was responding, it would just say use COVID precautions when you arrive at that. Now that most agencies have adequate supplies of PPE, I know City of San Diego, CAL FIRE, City of Chula Vista, and the Sheriff's Department no longer utilize that system. And again, that data was only held for the couple weeks that individual would be COVID positive, and it was just an address with no personal information. But again, most law enforcement agencies are not utilizing that because they have adopted the posture they have plenty of PPE and they should be utilizing it for every call. That concludes our briefing for today. We'll be back with you next Wednesday at 2:30, along with the regular updates the county puts out daily on the numbers. Our vaccine dashboard will continue to be updated in real time. If we have the new portal before next Wednesday, we will certainly roll that out and share that with you along with anyone else. And again, we continue to encourage everyone, please, we've got a ways to go to get these case counts back down in a comfortable range, and so we need to continue to follow the public health orders. And we ask for the public's continued patience as we receive vaccines and administer vaccines, but it does provide us some hope and some optimism that we are headed in the direction we want to go as it relates to vaccines. So thank you all for your time today, and we will see you next Wednesday.